According to Austin Public Health's Community Health Assessment for 2022, there are 48.6% of LGBTQIA plus residents who do not seek health care when they're sick. We're here to find out why such a large percentage of people in our community don't have or choose not to seek health care and uncover solutions to close this gap. Welcome to Walkes Talks, your in-depth look at public health. Let's start the show. Hello and welcome to Walkes Talks, a new web series that shines a light on public health and promotes healthy conversations. I'm Dr. Walkes, Health Authority for Austin Travis County. Today we're going to talk about the staggering gap in healthcare for the LGBTQ2IA plus community. But before we do, I think it's important that we touch on the history of healthcare in the community and how it's affected people over the years. Take it away, Buddy.
Thank you, Dr. Walkes. You may have heard about Stonewall or the Compton cafeteria riots, but you may not have heard about the protests on Whitehall Street. On September 19, 1964, one of the first gay rights protests ever organized was held in front of the Army building on Whitehall Street in Manhattan, New York, after way more than 2,400 people were kicked out of the US military for being gay. This does not include the various discharges the gay community in the US military faced, substantially increasing that number higher than officially accounted for. Many even faced a less than honorable discharge and were justifiably outraged when the government shared or leaked their private information outside of the Defense Department. A few decades later, in 1993, then President Bill Clinton signed Defense Directive 1304.26, also known as Don't Ask, Don't Tell, bill into law to fight the stigma the gay community faced trying to fight for our country. Though controversial, the law was aimed at protecting the LGBTQ community by forcibly silencing gay community members in uniform, keeping their identity secret, rather than addressing the root of the issue, such as homophobia or transphobia. In 1981, gay communities in New York, San Francisco, and LA began to report compromised immune systems. Doctors started to refer to it as gay cancer, and then gay-related immune deficiency, also known as GRID. The name changed once again to Acquired Immune Deficiency Syndrome, more commonly known today as AIDS. The disease baffled doctors, and it took 2 years to find the cause, due to poor funding and lack of support from the Reagan administration. 2 years later, the cause of the virus was determined to be the human immunodeficiency virus, or HIV. 4 years into the epidemic, 9,000 people had been diagnosed, and over half of them had already died. Despite the death of 4,500 people in HIV diagnosis, the federal government did not prioritize putting funding towards finding a cause or a cure for the disease. The LGBTQ+ community continued to lose trust in the government's interest in protecting their health and well-being. As a result, grassroots coalitions such as the AIDS Coalition to Unleash Power, or ACT UP, were created as a political group working to end the AIDS pandemic, acting as a voice for positive change. In December 2010, Don't Ask, Don't Tell was repealed. President Barack Obama signed legislation into law that would allow gay service members to serve openly. This was a huge step towards equal rights for the gay community. The lack of trust in our government caused valid concern only a few months ago as mpox, a virus that causes extremely painful rashes throughout the body, began to spread through our communities. Mpox was wrongfully portrayed initially as a virus that was contained in the LGBTQI+ community, but we all know that's not the case. Anyone who is exposed to someone with Mpox, regardless of sexual orientation or gender identity, is at risk for getting Mpox. We encourage anyone who thinks they qualify for the mpox vaccine to visit our website. Like the viruses mentioned before, the mpox virus has been found in people of all walks of life. Understandably, frustration in our community rose due to a combination of there initially not being enough supply to meet the demand for vaccines, the legal hurdles local governments had to face to acquire the vaccine, the number of vaccines available locally, and the rollout treatment being prioritized to those who had close contact with someone who already had visible signs of the virus. The pacing to get the vaccines was slower than our community would have liked, creating a sense of unease and fear that history would repeat itself. Thanks to the hardworking people in our healthcare system, history did not repeat itself, and today we have enough vaccines for anyone who needs or wants it. And as of December of 2022, H.R.8404, or the Respect for Marriage Act, was signed into law, meaning same-sex marriages and interracial marriages are legally recognized throughout the nation. This is arguably the largest victory to date at recognizing the existence of rights of LGBTQIA+ people and people who believe love is love. Today, we as healthcare providers strive to right the wrongs in our nation's past and are working tirelessly to fight for equity in public health, as we believe public health is a right for everyone. Back to you.
With that, I want to introduce my next guest, Dr. Sandra Guerra from the Kind Clinic, and Jimmy Baker, who's with APH, the HIV Outreach and Prevention Team. And welcome to both of you. I'm really glad that you're here with us today to talk about a very, very important topic for our community. When we look at this new community health assessment that's been released for 2022, there's a very alarming statistic of 48.6% of our residents who are in the LGBTQIA community who are not seeking health care when they're sick. I'd like you to shed some light on that. Do you want to?
Sure. Obviously, that statistic is very alarming. We know that when people do not get health care, anything that can be prevented or caught early or have an intervention in order to help maximize the best possible outcome is being missed if people don't go get health care. There's so many reasons as to why people have chosen not to get health care, even when it is potentially available to them. The number one most striking reason I know that we know of is about cost. The cost of healthcare can sometimes be a barrier for people. They don't have insurance. But then we add another layer of complexity, and that is, in this particular community, feeling a mistrust because of previous experiences to the healthcare system. So not being recognized, respected, understood, welcomed, appreciated, made to feel like they are in a safe place is unfortunately something that a lot of our population that we serve every single day actually has told us they have encountered healthcare trauma in the past.
Has that been your experience too when you're at outreach, doing outreach?
Yes, so during outreach we often inquire a lot of our individuals in the community who already have some reservations about getting tested alone. We mainly screen for HIV, syphilis, chlamydia, and gonorrhea. And within that calls for a greater conversation and digging deep into someone's sexual history and things like that. And because of those issues that was stated earlier, you notice that there's a lot of hesitancy, even when these people know that this is something that they need or something that's very beneficial to their daily lives. It's that fear from being misgendered or being discriminated against. And even myself, coming as a Black gay man in Austin, my PCP is a white gay man, which is cool. I have somebody who's in the community, which is dope, but also there is that level of intersectionality that where we just don't meet, because he lived his life as a Southern white gay man. I'm coming from the Midwest as a Black gay boy. And so really trying to find and mesh well with a provider, it took a while. Thank God I have one now and that everything's good. But yeah, I've definitely seen it in our population and on outreach as well.
And also the community health assessment, or the 𝐄𝐻 as we like to call it, reported that 23% of the LGBTQIA community do not have insurance. And so I know that we have the healthcare portability, Affordable Health Care Act.
Right.
And this is now open season. So what would you say to people that you're serving right now as to some of the factors that would need to be considered as they're looking at the insurance plans that are out there and available?
Well, first off, I would like to say that health insurance, of course, is not the answer to everything, but it is definitely a start. And so for people to have health insurance gives them an access point for care that is preventative, like we've talked about, but also for those instances that we can't predict. We can't predict the car accident. We can't predict when the appendix is going to rupture. We can't, all these different things that happen to us, our health insurance kicks in and is able to help. So yes, right now is open enrollment season for the Affordable Care Act plans. That information can be found on the Health Exchange, and we encourage people to do that. We've also found that over the last several years, there's been some changes done to it, which actually have made it truly more affordable. Where in the past people used to joke, oh, you know, it's not quite as affordable as you would think, but now due to government subsidies, a lot of those plans are actually quite affordable. And we even have found, like even at our Klein Clinic, even for our patients, there are patient assistance programs that even help offset that little bit that someone is required to pay. So I think it is really a great time for individuals to go out and at least explore that option, because access of care, medications, emergency care, all those things are part of adulting in America nowadays. So, yeah.
So when we look at health plans, because that was kind of the first thing we talked about, is cost as a barrier to access to care. Are there certain plans that are better than others when we're looking at trying to get medications, say, for treatment of HIV, or even more importantly, not more importantly, but something that we're really striving to do as well is get people on PrEP. So are there certain plans that are better than others for getting those two things achieved? And is there a place where people can go to look at that information so they won't be surprised when they go to get medications, not only for the cold, the flu, you know, the ache, the sprain, whatever, but also for PrEP and HIV care?
It is recognizably a complicated system, right? So even though you do get health insurance, it doesn't necessarily make the pathway that much easier. So when you do have, and you are going through the process to select, I would definitely speak with someone that is a professional that knows how to navigate the system. At the Klein Clinic, we're very fortunate that we have a great group of people, and we have partnered with a organization that is really geared at the special needs of the LGBTQ plus community. They're able to really give based on what their financial information is, their background, their health history, and what they're likely going to need in the future in order to give them that advice. So it is something that, but yes, some insurance plans are easier to work with when it comes to getting medications covered and what needs to go into that in order to get those medications covered.
But it's true, Jimmy, that in our community there are resources for people that don't have insurance, and so they
Absolutely.
can walk in and get care and be treated. Can you talk a little bit about that?
Yeah, so within personal and professional life, who I've dealt with as far as like obviously 𝐼𝐻 Clinic, they're really great as far as getting insurance. Ashwell Clinic does a really good job as well. Community Care Partners, they can hook you up. People's Community Clinic also has a really, really great sexual health program that they're developing right now that's helping their patients get access to insurance. But then I also think about, you know, those who are benefited enough to have insurance and like policies that may not even cover all of like the gender affirming care that some people need. You know, like City of Boston, one thing we learned was that there are some gender affirming surgeries that our insurance does not cover. And it's amazing because we have such good insurance, let everyone tell it, that these are minute things that we don't think about or we don't know. And then we have to discuss them with HRD and moving forward and pushing everything after that point. So the resources are out there, and it's really a matter of finding those gatekeepers and determining who are the people who are the most knowledgeable about the information. And through that, you can go to like queer events, rain, Fourth, all of the streets and everything else that goes along with our parties and things like that. There's usually always a space for sexual health and wellness within those spaces. So definitely don't be afraid to reach out and discuss and have those conversations. Even if you are at the bar or on a patio in a nightclub or something like that, we're there for that exact reason, is to provide those resources for you.
So can we also talk a little bit about what's happening beyond the access the issue of access due to cost, and talk a little bit about the experience? Because I know that as a Black woman, there have been times when I've been in a healthcare setting and I have felt that I'm not supposed to be here kind of feeling. Talk a little bit about that and what you're hearing and seeing in your roles.
Yeah, I think as physicians, we hear the gamut of the bad experiences, and especially in our environment where we are really catering to an LGBT plus community, and what we hear is heartbreaking, just heartbreaking. And I'm going to try to talk through some of these without getting emotional, but for people to be not only misgendered, not only dead named, they are treated as less than human. They are unable to access medications that they are needing because of a judgment that a healthcare professional is passing on them. It might be a physician who is passing that judgment. We have had people let us know that they would not take a referral from us because the care that person needed, well, they deserved it. But we think often about that healthcare professional, but we have to recognize that it isn't just the person with the license, it's the receptionist. It is the person who, validates your parking. It is the MA who brings you in. It is the phlebotomist who draws your blood. It goes across the board. And so to be a patient where you feel people are whispering, they are rolling their eyes, they're snickering, they are not looking you in the eye. These are all things that as humans we take for granted in the healthcare system, and to be taking care of a population who has come to us with this huge sense of relief. They come in our clinic and there's loud music going and there's flashy lights and it's a clinic, but it feels like a party. And yeah, you might not get the greatest news, but we're going to wrap around you when that bad news happens. And you're going to see people that look just like you and have so much respect for you. And they just relax. You can see it in their bodies. They're just, okay, now I can be honest with you. Okay, all right, fine. I'm going to tell you how many sexual partners I had. But in that other world, there's no way. And no one would even ask. No one would even dare ask anything about your sexual health, even though they should be.
And I think those are the beauties of like the kind clinics and the Ashwells that are out and about now, is that they are creating these intentional spaces for our community to get our services.
Yeah.
And it's like y'all are act like, I love kind so much. You know?
Well, I do too, but I'm biased.
And I think and that just the growth that kind has had from like the beginning of the like from beginning to like where they're at now, and the amount of diversity that y'all have put into like y'all practices and like really doing the work and putting it up front, I think is like testament. And it's obviously like, this is what we need in the community. These are the clinics that we need. These are the people, these are the gatekeepers. This is what our population needs. And I think it starts with training. It starts with our physicians, honestly. It starts with leadership. It starts at the top and works its way down. If leadership isn't on par, physicians aren't going to be on par. If physicians aren't on par, then the nurses aren't going to be on par, the MAs aren't going to be on par, the receptionist isn't going to be on par. And then it's just a mess going from top to bottom. So I think that's the beauty of like what y'all do, is that the leadership itself is involved in the community. They come from the community and they've experienced these discriminations themselves. So it's really dope to like see that in action, especially coming from just the public health side, where I am a little bit limited in the scope of what I can do. And we're just screening, and we're only HIV and STI, and it's very siloed. I get to see like all these other clinics and get to work with y'all and see how y'all function and act within the community. And it's like so dope, and it's so amazing that y'all are doing the good work.
Oh, thank you.
So talk to me a little bit about why it's so important that we address this particular disparity of insensitivity to this cultural difference.
Go ahead.
Culture will die.
Yeah.
How are we going to thrive if we aren't getting the help we need, the health we need? We're not going to make it, you know what I'm saying? Misgendering trans people, that is the most ridiculous concept in my mind, because it's right there in your face and we have the documentation where it says it, and it's like you are slowly killing these people by just not acknowledging their existence. And that's just the first step to me, is honestly acknowledging who I am as a person. I am much more willing to be open and honest about everything. And it kind of like reverts back to my father and how he refuses to go to the doctor for everything because he just doesn't like the way his doctor talks to him. And I'm like, my father's in his 60s. So I'm like, you're at an age where, you know, doctor visits are more common and things like that. And because you're facing these discriminations, you don't want to go. And it's so full circle when it comes, it's like all communities, all of the marginalized communities are like experiencing these issues, and we're all gonna like die off if we don't like really take hold and make these changes. It's scary. Yeah. It really is scary.
And I know we've seen in other communities where it actually creates a level of stress that can actually manifest itself physiologically and cause things like hypertension and lead to diabetes and depression and anxiety and smoking, all of the things that we throw into the pot, mix up and cause things like, you know, heart disease and early decline in health. So
it is. It's extremely important. It also is a perfect pathway to not get health care, to be financially strapped the rest of your life. Not only yours, but for any generation that comes behind you. So we know that getting healthy and being able to land that great job and being able to keep the great job and not taking too many days off sick from the great job and being able to live a healthy, prosperous life. The reason those words go together is because they are really tied together. So for our community to not get health care means they are always going to be a step behind. They're always going to be struggling, that those stressors are going to end up not only shortening life, but costing people so much more. So it is important to get health care. And, you know, we're definitely focused in this space of STI and HIV, which is very, very important, but it's bigger than that. It's not just those.
Oh, it's so beyond that.
Yeah.
So, you know, they say if you don't know your history, you're doomed to repeat it. Talk to me about what you see historically that has helped us move forward, and also think about, or, you know, comment if you like on things that we can do that we know historically didn't work, because we've got this fast track cities plan of 90-90-90, 90% of everyone treated, undetectable, on medication. So talk to me about that. What can we do now, and what should we avoid doing?
Well, for me, there are so many lessons that we have from other health situations in the past. One is definitely wrapping around a community and making them feel comfortable, accepted, not a threat to the general community just because of their existence. That's number one. Because we know when there are new or novel or different diseases, it is such this nature that people have to try to blame and ostracize someone. And so we know now we have been unfortunately living with HIV for so long, but thankfully we are at a point where there's medication and makes people undetectable, which means that they cannot transmit, which means that they can have a normal life like everybody else. This is a great thing. But I'm not sure that the general public recognizes that yet. Maybe in certain circles they do, but understanding that people who have HIV and are in care are just as likely to get high blood pressure and diabetes and everything else that the rest of the American population can have. So it is important to get care now and not treat this disease as some sort of fatal, horrible diagnosis that it was many years ago. And so I think it's a generational piece that we need to get better at educating the public as a whole about taking care of themselves in all ways.
So let's put a point on that. If you are treated undetectable, you can live a normal life. And we have people in this community that are really working hard to make that happen for everyone. That's huge, right? That's huge. What do you think, Jimmy?
You know, I'm always a fan of my elders and learning from my elders. One of the beautiful things that I've been able to do within my career so far is listen from the elders, those who were back in the 80s and the 90s, experiencing HIV and AIDS when it first came out, losing people, being diagnosed in the 90s and living to this day. You know, I just sat with two gentlemen who were in their 60s living with HIV, and the stories they're told were like heartbreaking. But then there's another side that you have to realize is that that's that group of elders. Now we have another group that are becoming the next group of elders. And if they aren't educated and if they don't know what's going on, there's no way that information is going to be passed down. Like fortunately, it was passed down to me and I was blessed enough to have one. So you have to there's also a self-assuredness that you have to put yourself in those spaces and be willing and open to have those conversations with those people who are the knowledge keepers, who are those who know, those who've experienced and all of that.
I think recently we saw with this novel infection that we had in our community, which was mpox. And I think for a lot of people that had been around and had been in healthcare and had heard all the stories, it was that bracing ourselves for, oh no, are we going to go through this again? Is it going to be another HIV? Now, thankfully, things that we've now learned, vaccination, distribution of that vaccination, getting people in treatment quickly, making sure that this isn't something that's stigmatizing, and jumping around and rallying around getting rid of the disease, not the person, I think is something that at least I feel many folks were able to do. Obviously, there's going to be some of those detractors and some of the people who are unfortunately unable to look at it that way, but the enemy is not one another. The enemy has always been an illness that we're trying to combat.
Right, exactly. Looking ahead, particularly for people that maybe don't have that support system, Jimmy, can you talk to me a little bit about resources?
Absolutely. So my favorite resource I probably want to recommend is 𝐄𝐲. 𝐄𝐲 Austin is a website that has a lot of resources, and it's all divided down through marginalization. So we have Black LGBTQ, we have Pacific Islander LGBTQ, they have youth, they have elders, they have people living with HIV, people living without HIV, people just interested in normal sexual health. All of that, they list almost every resource that is in Austin and available to you. So if you have access to a laptop, it's a simple Google search of 𝐄𝐲𝐢𝐬𝐿 Austin, and you will have instant access to a list of resources. But then also too, there are programs that are out there like �KIND's outreach program, Asheville's outreach program, Vivint's outreach program, our outreach program. People's has a community clinic. Community Care is growing a sexual health program right now where they're training their physicians and all of that jazz to be more sexually competent, more competent as well. So the resources are out there. There's so many gatekeepers, and it's hard to, like, I don't want to name call anyone out right now, but there's so many people that are in the community that are really actively doing the work. And if you really think about it and pay attention, we're all interconnected. We're all interconnected. We all work in the field. We are either at �KIND, Asheville, Vivint, 𝐄𝐲, or APH, and we're all like doing the work. And that's kind of like, that's the goal, and that's who you want to reach out to, is find someone who is actively doing that work. And it's hard because the community is so gay kept. And then especially the further you get down to it, like the Black gay community in Austin isn't similar as the white gay community in Austin. So there are differences, and there are events and things that are held a little bit more close to chest because we don't want those spaces to be interrupted or disrupted or anything like that. So you still need to find that space as well and figure out where you belong in that footing too. So I would start off with 𝐄𝐲, then I would do a quick Google AIDS service organization in Austin, get all of our information, reach out to all of us. You can get on Austin HIV website. We have information on every ASO in the county. And yeah.
Okay.
Yeah.
Sandra, what would you say to a physician that may not be in a space where there is a large population of LGBTQIA in their practice, but they want to know more, they want to get more information, they want to get that information about cultural sensitivity, or just a physician that's dealing, say, with a teenager that may have questions and they want to help that person. Where would you point them?
First off, yay.
Yeah,
Good.
exactly. Yeah.
Thank you.
Yeah.
Absolutely.
Yeah.
Let's talk.
Yeah.
I have plenty of resources to be able to share with you.
Right.
Come hang out at the �KIND clinic, for a day, a week, and you'll definitely absorb it from just being there. But there are a lot of great CME, continuing medical education programs that are available online. Some of them, of course, are in person. But it is about the learning and being receptive to learning and recognizing, no, I didn't get taught this stuff in med school either, or residency. That's right, but it still matters. That lifelong learning piece applies in this regard as well. And as far as not thinking that you have a significant portion of your population that fits into that category, means that you just haven't asked. And so until you as a clinician become comfortable asking people about the most private, intimate pieces of their life, no matter what they are gendered, no matter who their partners are, until we become comfortable as physicians, we're never going to know what the reality is of our population. Even very basic things, when you are an OB-GYN out there and you're taking care of people who are pregnant and you assume that they're only sexually active with the person who made them pregnant, you probably haven't asked the right questions quite yet. You can't always make those assumptions. You need to be able to ask. And so we definitely have the tools to be able to ask people that. And there are resources out there available. So yeah, give me a call, send me a message. Happy to direct you on how to get comfortable in that space.
Great, thank you.
Sure.
Thank you both. like you to give us some closing remarks as we wrap up.
Y'all, it's out there. The resources are out there. The help is out there. The love is out there. The appreciation for you is out there. Open your mind up. Open your heart up. Just go find it. And trust me when I tell you, you will never regret an inch of what you did at all.
I think for me and for us at the Kind Clinic, we are here. We are there. We are everywhere that you need us to be because we want you to be healthy. Get health care coverage if you can. Get insurance if you can. And even if you can't, we're still going to be there. And we're going to treat you with respect and with dignity. And we're going to get you what you need.
Thank you.
Thank you.
Thank you for joining us today. We at APH are here to support our community. We want all of our brothers and sisters in the LGBTQIA community to know where the resources are. If you look at the credits of this production, you can see where those resources are. There'll be a great list of them. You can reach out to APH, look online at our website as well, and we'll point you in that direction. Don't delay. Go get that health care. Be well. Thanks.